5%, and we know that President Duterte was irate that he couldn't push it forward, threatening, in fact, imprisonment at one point. For those who refused to be vaccinated, to your mind, what were the main reasons, even among very vulnerable sectors manifesting grave comorbidities? Do you manage, in hindsight, to explain why the low hesitancy, despite the fact that people were falling ill and many of us lost relatives in the pandemic? Yes, you're recognized, Vince.
Thank you very much, ma'am. I think just to put things in perspective, there were really two main and very serious challenges during the beginning of the vaccination program, which was sometime in the late part of 2020 leading towards 2021. The first one was really the lack of supply. It was very difficult to get supply of any vaccine.
Yes, so part of it was a supply issue.
It was a supply issue.
Yes,
but
we're all aware of that.
coupled with that was really what Yusek Rosette mentioned, which was really a very strong hesitancy issue on the part of the public. As the surveys at that time showed, it was as low as 25% to begin with, meaning only about 25 to 30% were actually willing to take a COVID vaccine. Right. In order to address this, I think upon directions of the president himself at that time, there was really a very, very strong multi-sectoral effort, which included the government agencies as well as the private sector. Sure. In fact, I recall there was a very strong campaign to combat that. And this was really also borne out by a lot of disinformation.
And we continue to be grateful for the participation of the private sector, the SM Group, San Miguel Group, the Razon Group, who all bolted in and showed their civic-mindedness, offering for free so many vaccines. The LGUs were also at the forefront. My question is, during that period of great vaccine hesitancy and intermittent supply, during that more or less 6-month plus period, how many probably died or contracted severe COVID? Do you have any data at all?
Madam Chair, during that time, we started off with during the second quarter of 2020, that would be...
Come again?
During the second quarter of the year 2020, when the COVID started, we had a total of 33,991 illnesses and 1,936 deaths. At the end of the year 2020, we had a total of 158,404 illnesses and 3,678 deaths.
This is still 2020. Paano yung 2021? Up to the second quarter, sabihin natin.
Yes, Madam Chair. During 2021, second quarter of 2021, we had a total of 646,760 illnesses and 12,689 deaths.
So it climbed radically.
Yes, Madam Chair.
Tapos, nung katapusan ng 2021, kung kailan talagang nagsimula yung marami na nagpapabakuna, ilan ang nagkasakit at ilan ang namatay?
During the fourth quarter of 2021, only for the fourth quarter, we had a total of 2.
This is not cumulative?
Not cumulative, Madam Chair.
Can we have cumulative? Perhaps if not today, then you can submit it.
Yes, Madam Chair, we will provide that.
Sa last quarter lang po.
Sa last quarter lang po ng 2021, we had a total of 298,452 illnesses and 7,878 deaths.
Yung third quarter, para maidagdag na lang natin lahat, yung third quarter po.
Third quarter of 2021, we had a total of 1,117,896 illnesses. Just wanted to emphasize, Madam Chair, that during this third quarter, we had the Delta variant.
Yep.
And then the deaths during that time, the third quarter of 2021, was at 21,424.
So, these are shocking numbers. The mortality and morbidity rates are terrible. And this is the period that we refer to and that the Reuters article refers to. Yes, Mr. Vince Dizon, you're
I
raising
just
your
want
hand.
to just very quickly just highlight that very important data point that Yusek Rosette made. I think the 6-month period you're mentioning, no, is really a period between the first quarter of 2020, around February, and towards the third
Pero wala
quarter,
pang
2021, sorry.
Kailan ba nag-umpisa yung bakuna?
2021 po, March 1.
Kaya nga, so,
So-
yung first quarter hindi talaga kasali, second quarter lang
Opo,
pinag-uusapan.
but I think the importance of the first quarter is that this was during the time when the outbreak of the Delta variant started in India, if I'm not mistaken, and it would eventually and inevitably lead
Parang
to
yung Delta was much later in the year.
hindi pa, ano po yan, middle of 2021. Mga
Yeah,
ganun po.
third quarter.
Opo, mga ganun po. So I think the critical timeline that you mentioned, it's made even more critical because of the Delta variant. Kasi yun po talaga yung, I think, considered the most deadly.
Okay.
That's why we needed to really vaccinate as many and as fast during this period. But unfortunately, because of hesitancy and as shown today, the disinformation that came in during that time,
So you
it made
do
it
think
doubly...
so you do think the information had its malign effects?
Oh,
and,
definitely, ma'am.
Truly worked against the Filipino people. The numbers are shocking. We're talking about millions, hundreds of thousands. This is no meager number. This is
No.
much worse than the body count and casualties of war.
Yes, ma'am. That's why I think the president really at that time really expressed a lot of frustration because he knew that it would lead to illnesses and sadly death.
Thank you very much, Mr. Dizon. Yusek, one last question. As a doctor, is this the last question? As a doctor po, is there any valid reason at all why people should be dissuaded from receiving Sinovac shots? I know it's a mere 50+% efficacy, but it's at that time was better than nothing, right?
Madam Chair, first, based on studies, Sinovac prevented 51% of symptoms if you are to receive that, but 100% protection from death and from severe disease of COVID-19. And as a doctor, based on the evidence at hand, wherein the Food and Drug Administration of the Philippines has given its emergency use authority based on safety and efficacy, and also the WHO emergency use listing, Sinovac was included, and based on our experts' recommendations, I will not have that kind of issues regarding this vaccine and will not dissuade people to receive the vaccine.
Thank you very much, Yusek. So we have that on record that there's really no medical reason to object to Sinovac or even the other Chinese vaccines. Kaya lang, kailan ba dumating yung iba, yung iba't ibang Western vaccines, ika nga?
Yes, Madam Chair. During the first quarter also of 2021, after the donation from the Chinese government of Sinovac in the last week of February 2021, AstraZeneca vaccines came, and these were donations coming from the COVAX facility. A total of around 500,000 came.
So that was first quarter of 2021?
Yes, that was first week of March of 2021 where AstraZeneca came. And then the other Western vaccines came around May already, Madam Chair, but only in trickles.
Thank you very much, Yusek. Thank you very much, DOH. Punta muna tayo sa DFA. Having heard the doctors as well as the other specialists, can we ask from the DFA once again that if indeed the U.S. military orchestrated an anti-vax misinformation campaign in the Philippines, did they violate local or international law? Does this action contravene the principle of non-intervention in the International Court of Justice? And even, as some scholars and the New Zealand experts say, that this information, which affects public health efforts during a pandemic, is a possible violation of international law with grave consequences. Yes, Secretary Manalo or anyone from the DFA, please.
Thank you, Madam Chair. On that particular question, I don't think I can really give an answer on whether it did violate international law. I suppose.
Well, if we assume
Yeah.
that what was written is in fact accurate, can we say that this